When people don't realize that you experience food insecurity, they say things to you like, you know, single moms on food stamps. I mean, I've never not worked full time since I was like 15. I worked through both my pregnancies. I pay all the taxes that I'm supposed to, and so it's difficult to hear that people think that I'm just like out to make money, because that never happened, ever.
Hello, my name is Ann Naderveld, and I am a primary care doctor in Grand Junction, Colorado. I work with a team of people focused on understanding and addressing barriers to health for low-income people in Western Colorado. We conducted interviews and surveys in Mesa County with medical providers, social service agency staff, and community members to better understand food insecurity in our community. Most people are aware of the impact of nutrition on our health and life circumstances. Good nutrition helps us feel healthy and strong and can prevent several chronic health conditions, benefiting both individuals and whole communities. However, not everyone in our community is able to afford an adequate nutritious diet. In this video, we are going to talk about food insecurity, or not being able to afford a healthy, nutritious diet, and how professionals, especially in healthcare and education, as they are generally trusted individuals for patients and families, can address this with the families and individuals they serve. We will discuss food insecurity, what it is and why it occurs, the impacts of food insecurity, assessing for food insecurity, barriers to address food insecurity, and finally, what you can do to help. At the end of this module, we hope you will better understand food insecurity and what your role can be to help mitigate this issue. We believe that no one should go hungry. Food insecurity is defined by the United States Department of Agriculture as the lack of access to enough food for an active, healthy life. So simply put, it's not being able to afford the right kind of fuel for a healthy and active life. So no doubt there are people watching this video who have experienced food insecurity. In fact, we found in our survey of medical staff and social service agency staff that 28% and 62% respectively had experienced food insecurity in the past or were currently experiencing food insecurity. However, many people have not had that experience and may not be familiar with the challenges faced by those in our community who experience food insecurity. Food insecurity doesn't always mean someone is hungry and may in fact be associated with obesity. Hunger is an individual level physiologic condition or feeling, while food insecurity is the household level economic and social condition of limited or uncertain access to adequate food. Food insecurity has a spectrum of severity. The red and orange end of this chart reflect what most people may think of when they hear food insecurity. Individuals experiencing that level of food insecurity are experiencing hunger because they simply don't have enough to eat. However, other people experience what is called hidden hunger, meaning they lack access to nutritious food and may in fact be overweight or obese due to feast or famine eating habits. Food insecurity is considered to be a social determinant of health and a social determinant of student success. Social determinants of health are the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health and quality of life outcomes. Access to and quality of education is often considered a social determinant of health, and in turn, educational outcomes are affected by other social determinants. So other social determinants besides food insecurity include transportation, or the ability to easily get to a store that provides nutritious food and cart it back home. A stable home where we can store and prepare our food and enjoy our meals. The ability to pay utilities to keep the heat on in the winter and to keep the refrigerator and stove on. And finally, things like violence in the home and social isolation. Food insecurity is the most common social determinant of health and student success. So prior to the COVID-19 pandemic, the rate of food insecurity in the United States was between 10 and 11% across all households, and around 13.5% in households with children, showing that it's more common in families with kids. The economic effects of the pandemic led to an increase in food insecurity, and now it is estimated to be up around 17% nationwide. In Colorado, the statewide rate of food insecurity in 2018 was 11.3%, with 15.1% in households with children. In Mesa County, where we did this research we'll be discussing, overall food insecurity in 2018 was 13.8%, and child food insecurity was 16.9%. So the short story is that food insecurity is much more common in families with children than without. These rates have increased due to the COVID-19 pandemic. If you're interested in learning more about food insecurity rates in your community, you can find information at map.feedingamerica.org.
I was food insecure when I was pregnant with my oldest daughter. She's 16 now. And then the worst, besides when I was pregnant, was when I got off food stamps. I still was working. I've always worked full time, and my kids were in school, and I just had very little money. My income was still low, but it was more than would qualify us for food stamps, and so that was definitely like the last thing that we would buy in terms of expenses. Like I would always pay my bills, and then, if we didn't have money left over, we went to food banks. Like when my son was a baby, he lost weight when he was very small. He lost half a pound when he was 4 months old, and that's just massive. It was a total emergency. And then like when the day my doctor, I remember when she told me, you have to go buy formula today, right now, and I had no money. So it was hard. I wish that people knew that that food is the last thing you buy. And how many people there are that will never qualify for any benefits that will also never have enough money for all the food their families need. It happens so frequently. I think we should talk about it more so that people don't think that it's so rare.
Social determinants have significant impacts on both health and educational outcomes. We know this from research indicating increased mental illness, obesity, diabetes, and substance use in adults, and then asthma, weight issues, school failure, and mental and behavioral health issues in children experiencing food insecurity. Poverty itself, of course, plays a role, but the associations with these illnesses persist even when researchers take poverty into account. It is likely that these issues are related to poor nutritional intake and the stress of worrying about or not having enough food. So this graph explains the cycle of food insecurity. Food insecurity leads to coping strategies that affect diet quality and eating behaviors. People often have decreased bandwidth to plan and follow healthy behaviors. This then leads to chronic diseases like diabetes or obesity. These conditions can result in increased healthcare expenditures and decreased employability. And this in turn leads to decreased income and having to make financial choices that then lead to increased food insecurity. However, we also know this from experience, as we will hear from a primary care physician and the director of nutrition services for the school district, as well as the director of a food assistance service in Mesa County, Colorado.
People who live with chronic medical conditions already are vulnerable because they may not have regular income. And if they already are in a place where they have impaired mobility, impaired resources, less social structures that help them with getting food, that affects them directly. Certainly poverty or lack of resources and social support all lend to that. It's not just access to food that is sometimes hard for our patients, but it's also the quality of the food and regularity of access to that food.
Food insecurity affects everything that throughout the course of their school day. It affects how much their attention span is when they're in the classroom. It can also affect them with their ability to retain information and to be able to interact in the classroom during the day. And And so that definitely it impacts everything. And it also impacts their social and mental well-being, how they socialize and interact with other kids. Behavior issues are a major impact when kids don't have enough to eat or have food insecurity challenges at home.
One of the things that we have done through funding from Hunger Free Colorado, as well as from our Family Resources Center Association, is to begin a campaign around No One Should Go Hungry. Hilltop strongly believes that every individual in our community deserves the right to be food secure, and food stamps is one of those economic benefits for individuals. We are also collaborating with Cooking Matters and CSU Cooperative Extension to provide local produce. They bring it to us once a week, and we're able to distribute that food not only to the individuals we support in our services, but to our staff. We provide menus and recipes, which is really cool because often individuals whose socioeconomic status is not in the middle class might not know how to cook some of those fresh produce. We know that if children are fed well, they are more likely to graduate from high school. We know that it lowers dental costs. We know that it impacts and has a reduction on long-term health care costs for individuals. We also know that if they're food secure, they are able to spend those resources on other economic stability kinds of things, their rent, their utilities, etc.
As you heard from these experts, good nutrition supports good health and educational outcomes for people in our communities. No one should go hungry because food insecurity and hunger affect our health, our lives, and our whole community. So now that we know what food insecurity is, the prevalence in our community, and how it relates to health and education, let's talk a bit about how to identify food insecurity. There are validated questionnaires developed by the USDA that can be used to identify and classify food insecurity. However, they are very long, and therefore a 2-question screening tool has been developed that is widely used in primary care practices. This tool identifies families or individuals at risk for food insecurity, requiring more investigation for people who respond positively to the questions. The screening questions do a very good job of not missing anyone who is food insecure. So for people who like statistics, they are very sensitive. The 2 questions this tool asks are, number 1, we worried whether our food would run out before we got money to buy more. Was that often true, sometimes true, or never true for your household in the last 12 months? And 2, the food that we bought just didn't last and we didn't have money to get more. Was that often, sometimes, or never true for your household in the last 12 months? A response of often true or sometimes true to either question means positive screen for food insecurity. These questions can be used alone or in combination with questions designed to identify the other needs related to social determinants of health, like housing, transportation insecurity, or domestic violence. Some primary care practices are now screening for social determinants of health-related needs. However, not all are, and we learn that sometimes patients don't want to answer the questions honestly, as they fear consequences of reporting food insecurity. For example, patients told us that they worried that people would think they weren't able to take care of their children, or even that Child Protective Services might be notified if they reported food insecurity. Therefore, in many cases, a conversation or observation is needed to identify food insecurity.
I think probably the hardest thing as a practitioner is really the number of other questions and other screening tests we're doing for patients. And so getting to the questions down the line of, do you have enough food, are difficult. And complicating that is that it's not simple enough to ask someone, do you have enough food? The question, I think, needs to be asked in different ways because people aren't always comfortable answering that question. They may feel awkward. They may not want to tell us. And so finding different ways to ask the question takes time. It takes trust. And so again, if it's a new patient and I have 20 or 30 minutes, it can be really difficult to get a truthful answer from someone who who really may not have a secure food source. I think another big telltale finding for me, or a telltale sign, is if someone's non-adherent to their medications, and some people may not think about this, but if a patient's not taking their medication, that might be because they can't afford it, which sort of sends us down this, well, what do you have money for? Or in that instance, it may come out, well, I can't pay my rent, and now I can't buy groceries. And so I think those signs of I'm not keeping my appointments, maybe I'm not able to afford some of my medications, I'm about to be evicted. If someone tells me that, I immediately go to tell me about, do you have enough food? This happened to me actually just the other day. I was talking to a gentleman who was pretty concerned. His rent had just been raised. And so housing insecurity was sort of how the whole conversation started. And immediately that led to, well, or can you buy food? And that led to, no, I can't eat some days.
In medical practices, patients might make comments about not being able to follow advice or recommendations given for dietary changes. So, for example, patients with insulin-dependent diabetes may reduce their insulin or report not being able to use it as often as recommended. Weight loss is typically only seen with very low food insecurity, and as we noted earlier, many people with marginal food security are overweight due to poor nutritional intake and feast or famine eating habits, which is eating large amounts of high-calorie foods when they have access to them. Things that one might notice in a school setting, for example, are children sneaking extra food, eating school lunch but not being able to pay for it, taking food home, or asking teachers or other staff for snacks. It may seem obvious that these behaviors would be connected to food insecurity, but sometimes that connection is missed.
You know, also healthcare professionals and schools should be really creative with how they ask kids about food. Like, I think it should be part of just a routine screening to say, do you have food that you will eat at home? You know, like my kids will say that they have food at home, but if you ask them that if they have food that they will eat at home, they might say no. So I think it's important to really gear your questions in a way that is specific to kids, the way kids think about food.
Many programs exist to address food insecurity to help us ensure that no one goes hungry in our communities. However, we found that many medical providers and school staff were unfamiliar with these programs and wanted to at least have some baseline knowledge about them in order to discuss with families if necessary. We'll hear about the main programs available in most communities from people who know them best.
The SNAP program stands for Supplemental Nutrition Assistance Program, formerly known as Food Assistance. And basically, it's a supplemental nutrition program to help individuals and families with their food purchasing power so they can buy nutritious foods. It's typically issued on a monthly basis through an EBT card, which is an electronic benefits transfer card similar to a debit card. Recipients of the SNAP program can use their benefit to purchase multiple items, including fresh fruits and vegetables, meats, poultry items, fish, grains and cereals, basically any kind of food available for consumption, including seeds and plants that you can use to grow your own food. Things that you can't use the SNAP benefit for would be alcohol, tobacco, paper products, pet foods, and any meals that were available for immediate consumption. So if you were to buy a hot turkey or a hot chicken in the deli, you wouldn't be able to use SNAP benefits for that item. Recipients of the SNAP program can use their benefits at any participating retailer, including grocery stores, at participating farmers markets, and even more recently online at stores like Amazon and at Walmart.
So the average amount that individuals in our community receive from a SNAP benefit is around $200 to $300 monthly. As we all know, when we go to the grocery store, how much it costs with groceries. So SNAP really is a hand up, not a hand out. It helps individuals sustain economic stability and add nutritional food to their menus. The other piece is that it brings economic security into our own local community.
The WIC program is a supplemental food program for women, infants, and children. We serve pregnant women, women that are postpartum, and children until the month of their 5th birthday. Participants that qualify for the WIC program really have to be within income guidelines. If they are on food stamps or Medicaid, they automatically qualify. For example, a family of 4 can make $4,040 per month. So that gives you an idea of the income guidelines for a family. Foods that are provided by the WIC program are often foods that you already eat. For example, fruits and vegetables, whole grains, peanut butter, beans. You may even see in the store items identified as WIC items, and often those are healthier options, and it helps a participant find the foods easier. A very important part of our program is breastfeeding education. So we help support mothers, we provide breast pumps, and we really want moms to know that that's the healthiest way to feed their baby. Referrals are also very valuable to our participants, and we give a lot of families information about local programs like Nurse Family Partnership, Safe Care, and the Immunization Clinic in Public Health, just to name a few.
Anyone can access a food pantry. Now, different places may want different information just so they can collect that for grants or other reasons, but we do not limit anyone by race, gender, or even citizenship. We want everyone to be able to get the food that they need so that they can function and operate in their lives. Each food pantry may look different. Most of them will have what we call an intake process. So they want to get your information, and it's really just so they can help you. They would be able to connect you to other resources that may work for your situation. If you don't know where a good or the closest food pantry is, we have a great resource called Colorado 211. You just pick up a phone, dial 211, and whether you need food, housing, other resources, they can get you connected.
So students in Mesa County that are eligible for free and reduced meals typically have to do one of two things. One, they're either covered through the SNAP program, which is the Supplemental Nutrition Assistance Program, and they're automatically then certified through the school district to receive free or reduced meals, or they can apply through an income application process. And that income application process basically entails, it's a pretty simple form, 5 to 10 minute completion, and it basically entails confirming their household size and what is the income level. While the students that are eligible and participate in the program, they receive fuel to learn. They receive the fuel to get them through the school day. We have breakfast in all 40 plus of our schools across District 51. We also offer lunch. So those that are eligible could come in and receive a very healthy and nutritious breakfast and lunch every day to help fuel their learning and to help them with other challenges they might have to get through the school day. There's a lot of work, a lot of times it's staff at schools, our staff that are in the kitchens, along with school staffs, are really attentive to making sure that students that maybe are not eating at a table in the cafeteria didn't bring a lunch home or a breakfast from home, and to ask them, hey, do you need to get something to eat? We want to definitely provide that for you. And so being able to know that our program offers that to students and we can go ahead and get that meal for them is really good.
So we've established the reasons why no one should go hungry and learned about some programs intended to alleviate food insecurity. But what can be done if food insecurity is identified? Ideally, you would refer to these food assistance resources. However, this is not always easy or welcomed by people experiencing food insecurity. Research and experience suggests that about half of all people who screen positive for food insecurity decline assistance or a referral to assistance programs. In addition, we know that many people who are eligible for SNAP or WIC are not enrolled or do not remain in the program even when still eligible. There are many reasons for this, which we'll hear about from our experts.
According to Hunger Free Colorado's 2019 impact report, the eligible but not enrolled rate for Mesa County is currently at 44%. In my opinion, there are a lot of reasons that could lead to this high eligible but not enrolled rate in our community. I would say one of the biggest ones is just stigma within the community and how people may be perceived if they're receiving this benefit. Another one is just pride. Some people just feel too prideful in order to participate into this program. It's just not something that would ever be on their radar to want to do. Another reason could be lack of awareness. They simply don't know what programs are available to them in their community that could be of assistance to them in their time of need. And then also there could be a little bit of hesitation just because people don't know how to take that first step to apply. They may be aware of the program, but they're just a little fearful of the steps to get there. Some things that I think could be done in order to improve access to the program and reduce the eligible but not enrolled rate would be if we can reduce some of the stigma that surrounds applying for benefits in our community and make people feel more comfortable accessing our programs at the time of need. Another thing that could be done is just creating more awareness and getting the word out there into the community that these services are here to help people in their time of need, and it's okay to apply. This is the reason why these programs are here.
I see food insecurity stigma impacting our community in sort of the following ways. And I'm going to start with a couple of personal stories. One, as an adolescent, when my parents got divorced, we were in a place for a very temporary time that we needed to access food stamps as a way for us to have economic security. And I just remember how embarrassed I was, how shameful it was, how others looked at us funny, including grocery clerks. I even told my mother, you cannot make me go to the store, because at that time, food stamps were like this book. And so it was very obvious. And unfortunately, 40 plus years later, we are really in that same position around stigma.
The ways that I experienced stigma were like in the grocery store. You know, I always waited until the very last minute to pull out my food stamp card because there was a definite reaction from people like in the line, or I would try to like have my kids over here towards the end of the line and turns and use my card so that people couldn't see, because my kids would notice when people had a reaction, and it was very uncomfortable.
There can be so many reasons why people won't get food. I myself was in a tough financial situation before I came to work at the food bank, and I simply wasn't sure how I could pay for my son's daycare, but I didn't even think about food because I had certain nutritious needs, and so food was a priority for me. And it took somebody coming to me and saying, you know, if we give you food through our food distribution, then you can use the money that you would have spent on food and pay for your child's daycare. And so for some people, it just takes a difference in thinking and then realizing that there's great food available. I needed to have certain food items, and they had them. They have gluten-free, they have organic, and fresh produce is a huge thing that we're working on distributing more and more of here in Mesa County. So I think lack of knowledge is one reason, and then just a historical feeling of you can get by, you can make it work. We're in a place these days that it's impossible for some people to physically make enough money in order to make ends meet due to sometimes medical reasons, sometimes because of the economy, and other reasons it's just unfortunate circumstances they find themselves in. So we want everyone to know that if you're in one of those places, you can get the food that you need. So you never know where other people are at. You never know what situation a person is in, and they may need the same help that you do. And so you taking a step forward and saying, well, I'm going to go ahead and ask for help, may be the wall that is broken for somebody else to feel that they can get the help that they need.
I think some patients are hesitant to accept help for food insecurity once it's been discovered that they might be food insecure, because maybe they've had a negative experience in the past. Maybe a friend, family member, or somebody else in the community have made them feel bad for being food insecure or have stigmatized it in one way or another. Maybe they've heard things like, work more or work harder.
So, as you can see, there are many reasons why people in our communities continue to go hungry and experience food insecurity. Our research corroborated what you've just heard from these experts. This first quote demonstrates how transportation can be a barrier to addressing food insecurity.
You can pick so many of each thing on the shelf, and then, normally, you'd load it outside to your car. Usually I have to take my kids with me because it takes all of their hands plus mine. But then it's bus fare for all of them, too.
Other barriers are related to perceptions and emotions surrounding food insecurity. Some people believe that they are getting by on a low income and would rather not accept assistance. While it may be true that they are getting enough calories, often nutritional quality suffers or people are unable to afford other necessities, what we sometimes call the treat or eat phenomenon, when people must choose between food and medication, for example.
When it is not something absolutely necessary, I would not like to use SNAP. There are people who really need it, and I prefer it more for other people who really need it.
Finally, our research and experts agree that another barrier is shame about using resources. People often accept help for the sake of their families and children, but report negative, stigmatizing experiences around receiving resources. Here are some things we heard about stigma in our research.
I think sometimes I'm judged by my weight when I go to food banks. I'm not as big as I was, but people act like, yeah, she looks like she really needs a food bank. She's not starving. So, like I said, people are mean.
I have gotten dirty looks myself in the grocery store checkout line, and it just makes me feel like less of a person. They see that I am using food stamps, the SNAP card that I have. I sometimes get a little side glance like, really? Does she need that? I think a lot of it is people thinking that other people are just pretty much living off the state, not doing anything to help themselves better themselves.
Related to stigma, we found that many people believe that other people use these services when they do not really need to, reflecting the idea that people abuse the system, even though program data shows that this is actually extremely rare. Our findings indicated that this misperception about programs being abused was most common for SNAP and WIC. This misperception may make people even more hesitant to use the programs even when they qualify because they don't want to be seen as abusing the system. What we learned through our interviews and survey of Mesa County residents is that food insecurity needs to be approached with empathy for each person's current situation, or an understanding of the lived experience of struggling to feed yourself or your family on a limited budget or other challenging circumstances. The SPENT simulator takes you through spending-related decision-making in a month of life on a limited income, and it takes about 5 minutes to complete. If you want to, you can pause the video now to play the simulator, or you could do it after finishing the video. At the end of this video, we provide a list of other resources that can help to increase your understanding of what it's like to live on a low-income salary. So, what are some things we can do to address food insecurity in our communities? First, normalizing the experience of food insecurity and use of resources can help people talk about and consider resources. Letting people know how common it is to struggle to meet food and nutrition needs can make sure people don't feel singled out. Second, make it clear that your aim is to help and support, not to judge or report. This helps both alleviate fears of being reported to CPS or something similar, as well as decreases the feelings of shame. And finally, respect the person's autonomy and expertise regarding their own needs. You can make it clear you are there to support in connecting to resources, but let them decide which resources and when to reach out. They may be facing many competing challenges and may feel that other issues take precedence for them.
I think we can do a better job of not putting people into a box of what we think they might need, but asking people what they need and then responding.
Our practice is screening for food insecurity with a 2-part screening questionnaire. We identify patients by a variety of ways through provider referrals, insurance, Medicaid, Medicare patients, or sometimes we just go into the room with folks and just screen because it seems like the right thing to do. That's why we are kind of asking patients in the room. Our care coordinator goes in, sits down with them, asks them the food insecurity questions rather than just kind of handing the survey out at our front desk. We want them to know we care. We want them to see a face with our coordinator so that they know if there are further insecurities, they could always ask for more help. Sometimes folks come into the clinic for intimate reasons, very personal reasons, and I want them to know that I am a safe person. I am a person that can be trusted, and I want them to feel comfortable with me. I let them know that this is a voluntary thing. They by no means have to give me any sort of information. And then I explain what the questions are and kind of why I'm asking. I let them know that food insecurity happens to everybody across the board. It doesn't happen to one group of people, it happens to all people. And then I kind of segue into the questions and let them know what I'm going to do with that information once they provide the answers to me. That being said, I think it's incredibly important to provide adequate resources. So I would never leave anybody hanging once they tell me that they are food insecure. I always want to provide them with adequate resources. And that means a little bit of research on my side of things, making sure that I'm hooking them up with a reliable resource. So making some phone calls, maybe the week ahead of time, making sure that food banks are up and running before I give those to the patient. The last thing I want is to send a patient to a food bank that is no longer operating because I lose the trust, rapport, and relationship building that I've worked so hard to build with the patient.
And under the surface, food insecurity is a big determinant of their health. And finding ways to address that in a pretty efficient way that doesn't tax our patient with more forms that they have to fill out, and if possible in a way that doesn't add another 5 to 10 minutes to an office visit that a physician really can't do, I think is important. So I am hopeful that we will, as we all understand how important food insecurity is, I'm hopeful that we find a way to integrate a discovery of that and positive, effective interventions for that without adding a ton of complexity to an office visit and to physicians' lives. Preferably, it's through other organizations that can help identify that. The worst thing is putting this on a physician's plate because it won't get done. The best thing is to have other people in the office, other ways to get at this, other places in the community so that it's sort of a public health effort.
We hope after watching and listening to this video, you are motivated to help ensure that no one goes hungry in your community. As a person of trust, you can make a difference by recognizing the signs of when someone may be food insecure and understanding the need for a supportive, empathetic approach. You may be able to start the process of connecting people with resources. In addition, talking about food insecurity and the realities of the situation in our community can go a long way in combating the stigma associated with it. We want this video to serve as a call to action. Please consider some of the following as first steps towards addressing food insecurity and advocating for those of us in our community who face food insecurity. Consider supporting Hilltop's No One Should Go Hungry campaign, or consider volunteering for a food assistance program like a food bank. It will give you insight into how these services work and the lived experience of people facing food insecurity. Make a commitment to educate your staff. Explore the resources provided, like the Poverty Simulator Spent, and consider sharing with your staff. Develop a resource list or plan for sharing resources easily with patients and families. Consider screening for food insecurity if you are not already. And finally, develop a relationship with food assistance organizations so connections can easily be made. You can visit these websites to learn more about the food resources available in Mesa County and the ways you and your colleagues can learn more about the causes and effects of food insecurity. We know the critical importance of nutritious food to our health and well-being, and we have the resources available to make sure that no one goes hungry. With your trusted, informed, and empathetic support, we can decrease how many of us experience food insecurity. Eliminating food insecurity would benefit our whole community, and together we can create a community where no one goes hungry.